Hi, my name is Max Shteiman. I'm originally from West Palm Beach, Florida. I completed my undergraduate studies at Washington University in St. Louis, where I majored in French and economics, but eventually I pursued medical school because I realized I wanted to commit to a profession where I would be challenged to continue learning and growing as a scholar, as a clinician, as an individual for the rest of my career, to best take care of the communities around me. Well, I first heard about the UQ-Ochsner program from my pre-med advisor at WashU during my undergraduate studies. She told me, Max, you've always done things a little bit differently. You've always pursued very unique avenues to reach your goals. So I want to encourage you to look into this program. And I'm so glad she did that, because I actually decided at the end of my pre-med studies not to pursue a medical education here in the United States for a number of reasons, but I felt compelled to do things a little bit differently. I was a kind of personality that always sought unique experiences to challenge myself that would later shape me into becoming a better informed, a better prepared and disciplined scholar, individual, and clinician. And I was absolutely right. Thankfully, everything worked out, and sure enough, this ended up being a tremendous opportunity, an adventure of a lifetime, and above all, a really remarkable educational experience that has prepared me to tackle any challenge I know as a medical trainee I will be faced regardless of where I end up practicing in the United States. You know, when I first got on that plane to Australia for the first time, I didn't quite know what to expect. But above all, I just felt so excited for this new opportunity, for this new chapter, and what I knew was going to be the adventure of a lifetime. And when I landed 15 hours later from LAX in Brisbane, I knew that I was ready than ever to mark this next chapter in my journey to becoming a physician. Life in Brisbane was much easier than I expected. So I was sort of blown away by how quickly I felt integrated into the Brisbane community. I quickly made friends with Aussies. I quickly found a favorite running path through my favorite neighborhood, South Brisbane, along the beautiful waterfront. I quickly found a favorite coffee shop to go to, and it was a remarkably warm community to be in. And the 2 years flew by, primarily because of just how easy it was to live there. To transition there from the United States to the other side of the planet was a far easier move than I expected. Transitioning from Brisbane to New Orleans was a very easy process. I think that's a testament to how well integrated the administrative teams are, both at UQ in Brisbane and then the Ochsner Clinical School in New Orleans. And I'll tell you what, even starting out in my first year at UQ in Brisbane, I was already well introduced to the administrative staff at the Ochsner Clinical School. And they would come visit from New Orleans to introduce themselves, to really establish themselves as support systems even during the first phase of our curriculum in Australia, and that really facilitated the transition to New Orleans to the Ochsner Clinical School. I'd say what stands out the most to me about my clinical experience at Ochsner is the breadth of patient encounters that I've experienced. New Orleans is a wonderfully diverse community, and Ochsner is the kind of institution that is so well equipped with the most wonderful resources, faculty, technologies to provide exceptional care for all of these different communities. And we, as medical students at the Ochsner Clinical School, were privileged to be at the front lines with these brilliant practitioners around us to learn how to best take care of these diverse patient populations. And this is a discipline that I know I'm going to take with me for the rest of my medical career, wherever I hope to end up. You know, truthfully, I want to end up in a more urban environment when I practice medicine, but I know that this kind of training has set me up to be as good of a provider as I can be. I think more than anything, studying across 2 continents has really developed my understanding on how to communicate with patients. I mean, I'm even thinking back to the unique intertwining of UQ's medical curriculum with, say, the sociocultural aspects of our curriculum. For example, learning about the Aboriginal and Torres Strait Islander populations of Australia, which we may not encounter here in the United States, but it's so important to understand the nuances of patient care in certain communities to inform us how to best consider the multifactorial aspects of a patient's needs and their cares, and that's what informs us as better physicians. It's what shapes us into being culturally competent, compassionate, empathetic providers for all patients. Over the past 4 years, I'm most proud of how I've grown as an individual. Obviously, I've grown tremendously as a clinician, as a scholar, but I'm sort of blown away thinking back that, I started this journey when I was 22 years old at the height of the COVID-19 pandemic in 2020. And now, 4-something years later, I've realized that I'm more ready than ever to become a physician. I feel empowered by the tremendous support network I've had now on 2 continents to go out there, trust myself, apply what I've learned for the past 4 years to be as good of a provider as I can be to any patient community in any part of this country. If I could go back and give my first-year self some advice, I would say to trust myself. I came into this program, into medical school, with a bit of self-doubt, not doubt at the opportunities that were presented, that I was privileged to be presented with at that point, but doubt of where I would fit in as a physician, where I would fit into the medical community, which part of the country I would fit in, what medical specialty I would want to pursue. But a lot of that self-doubt vanished when I realized how quickly I was integrated into this academic community, now on 2 continents, both in Brisbane and in New Orleans, and being surrounded by brilliant peers of mine, brilliant faculty members, physicians, administrative staff, who were there really, really committed to my growth as a clinician, as a scholar, as an individual. It was tremendously encouraging, it was tremendously inspiring. So I would tell myself to trust the process, trust the journey, and to trust myself. I hope to be a doctor that empowers my patients first and foremost, with myself sort of actually in the back seat, there to support my patients in any way I can, to empower them to take control of their own health. And now I'm at the end of my med school journey. I feel an incredible sense of gratitude for everything and everyone that has supported me in shaping me into the physician that I'm going to be very, very soon. It's been a tremendously rewarding experience.